Healthcare is our current favorite distraction from the Russian cyber invasion of America and the possible involvement of Trump groupies. So let's have a look at what the geniuses in Congress have proposed for the health and well-being of all Americans. It's well established that the House and Senate attempts at delivering on the brainless repeal and replace mantra have little to do with healthcare delivery to Americans. Healthcare is simply the cover for an $800 billion gift to already rich people. In the unlikely circumstance that you aren't fully enraged by that, consider that part of the windfall for the wealthy is a reimbursement of taxes paid on financial transactions, money that was used to fund Medicare expansion for our poor under Obamacare. That's right. These plans dig a deeper hole of debt for America because the 1% need more money. I guess I missed that turn when Republicans stopped obsessing over debt. Nice to know that it doesn't matter anymore, so it's okay to slather more cash on the rich. Enough about the struggling wealthy. We'll let them pull themselves up by their Gucci bootstraps and instead have a look at how the House and Senate plans will affect you. If you're poor, you're screwed. The Congressional Budget Office's analysis is that under the House plan, 23 million more Americans will be cut out of health care insurance entirely, which will effectively leave them without primary health care. Under the Senate version, that number drops to only slightly less cruel, 22 million more Americans whose medical needs we'll ignore. Either way, tens of millions of Americans will have nothing but a last-ditch, begging for mercy trip to the emergency room as their primary health care. Those trips are always made well after medical attention is needed, so the conditions presented to emergency room staff are far worse and often irreversible. That means people who might have been cured will die. Plus, a visit to the emergency room costs more than any other way to deliver health care, driving our overall cost much higher. Be clear that every hospital is required to deliver health care to whoever shows up at their door, regardless of a patient's ability to pay. That means that the cost to care for a poor person who drags into the emergency room and receives that expensive care is passed along to all the patients who can pay, like you. That's how slashing Medicaid will drive up your cost of health care. The Kaiser Family Foundation has crafted a nifty way to learn how the various cruel congressional plans stack up against the ACA, Obamacare. You can access the comparison with both the Senate plan and the House plan through links in the written blog. Just enter your age, income, the state in which you live. Then click on your county, review the results, and decide which plan you like best. Be sure to look ahead at what those plans will cost you 10 or 20 years from now. Good chance you'll be surprised, and not pleasantly so. But that's just you. Before deciding which plan to support, be sure to consider the poor people who will have no place to go but the emergency room for medical care under either congressional plan. Also, don't forget the rich people who need your financial support. The net of this is that both the Republicans in Congress and the President are so desperate to get a win that they are sucking up to the wealthy and abandoning our poor. That is to say, the win means more to them than the life or death of our most vulnerable. I'm Jack Altshuler.